I think it's important that our staff and our museum community reflects the community that we're serving. We want little boys and little girls to come in here and see people that look like them, or that people that look like their family working here. And it's just a better way if we have a more inclusive environment, if we have a lot of different types of people working here, we can make other people feel more connected to this museum. And that's important to us.
I believe that because I was the first in a lot of instances, like as an African American woman, and in being in electrical engineering, like my first job, I was the first African American woman in that position. When I was at LabCorp, I was the only Black female as a manager. So I have a very direct leadership style. I do try to nurture other leaders of color and different abilities too. So we do want to mirror the community, and so we do work hard to create an inclusive culture that embraces people of all colors, sexual orientation, and abilities.
For this one, I would kind of go back to my mom again, because my mom just really taught us to always be respectful of everyone and that you don't know everyone's story. And so I feel like in my life and in my work environment, I always try to be respectful of everyone's story and of where they came from. And I always just try to appreciate that and just be kind and encouraging to everyone. I would hope, I've worked with Zara now for a couple of months, I don't think Zara's ever seen me angry or overly frustrated, or so I like to deal with things with laughter. And I also like to think my approach is calm and steady and just consistent.
It definitely is.
And that I'm a taskmaster. I do like to have little check boxes and check our to-do list off. One of my favorite sayings is, how do you eat an elephant one bite at a time, is really taking us, breaking it down bit by bit to accomplish your goals. So I hope that that's how I lead.
So how do you see your leadership style and work contributing to more diverse and inclusive environments within your organization and the wider community?
My leadership style is allowing people to do themselves. I want people to be creative, have a space where they feel free, that they can make a contribution in their own way. And so with that, in our, where we are, we have, I gotta start that over.
Okay.
At D-UP, we have quite a few women and 2 men that are on staff, and it works out. I would say that our women are natural leaders, and I love having that opportunity to blossom wherever they need it, but then I'm not a micromanager. So I just wanna see what they can do, and I want them to trust themselves. And I think when you have people that are trusting themselves, walking in who they are, they can give more into what they're doing.
So from, let's see, within my organization, so within the Center for Community Engagement, we're surrounded by different age groups, different backgrounds. So just making sure all those voices are heard, always creating a platform for professional development for individuals, making sure that you all understand that, I'm extremely supportive. I think I do a good job of making sure that I don't make decisions on my own unless there's some things that I have to make a decision on my own, but making sure those collaborative voices are there. So like when we're in meetings, when we have to make decisions on things, like making sure that you all understand that you can be heard and that you can share your ideas and that you're in the decision-making process. Is what's really big for me. And then selecting people, like I said, from different backgrounds and different perspectives, different experiences, those learned experiences. Make sure to take advantage of all the talents that are in the room, right? Because I believe that everybody brings something to the table, and only through using all of those tools are we able to really be effective in the work that we do. And then from a community standpoint, just making sure that I have all the voices at the table. that are needed, right? And so if there's programs that we're having within the center, making sure that those voices are being heard, so those programs can be designed effectively.
I feel very fortunate to lead a team of dedicated professionals and volunteers, community volunteers who work every day to make our community healthier and stronger. Healthcare is predominantly a female-driven industry. You know, we have a lot of caregivers, we have social workers, we have nurses, we have physicians, we have all sorts of people, all sorts of professional roles in healthcare, and many of them are dominated by females. So I think it's really kind of inspiring to be part of a female team, a largely female team. We do have some males at the clinic as well, but a largely female team that's dedicated to caring for our patients and therefore the wider community. I love that the clinic works really hard to take care of the patients in the community and do everything that we can to make sure they have the services that they need. This might be getting off track, but one of my favorite patient stories at the clinic is a woman named Lorraine. And she said she ended up in High Point with 4 children as a single mom. Her husband went down a path that she realized was not healthy for her children or herself or for him, but he had to make some decisions. And so she invited him to leave the home. And she said, so I had these 4 kids. She said, and I did everything. They were my job. She said, I made sure I did what they got them what they needed. She said, the school fed them breakfast and lunch. I made sure they had supper. The school helped with school supplies, and what the school didn't, I made sure they had. I made sure they had clothes. I made sure they did their homework. I did for them what they needed. She said, because that was my job. She said, and I worked 3 different jobs to make it happen. She said, but those 3 jobs were all part-time. None of them gave me healthcare benefits, healthcare insurance. She said, so I did what I was supposed to do. I was taking care of them. She said, but nobody was taking care of me. And by the time I found the clinic, I was diabetic, I was hypertensive. She went through this whole list of things. But it really resonated with me because I thought that's what women do. We take care of our families, we take care of our community, we get things done that need to get done for the people around us. But we don't always take time to care for ourselves. And it's important to me that the clinic continues to provide that support to everyone in the community, but especially patients like Lorraine, who are working so hard to support herself and her family, but who's supporting her. And I'm real proud of the work that we do at the clinic that does support the Lorraines and the community.